Good day, everyone. We are the Group 2B of BSN3D and I, Jason Gonzalez, along with my group members, Cezar, Miko, Angelo, Gonzales, Ezer, Jardinico, and Gleb Jonsay will be presenting our research entitled Job Embeddedness and Intent to Stay of City Public Health Nurses. The retention of nurses is a global challenge that can affect healthcare systems and patient care. Public nurses play a crucial role providing essential services, but their retention is also a challenge. To keep nurses in their positions, it is necessary to understand the factors that influence their intention to stay. The job embeddedness theory can help determine the level of commitment of nurses to their organization and their intent to stay. The study aims to guide the determination of how committed public health nurses are to their organization and their intent to stay. So for the objectives, the study aims to determine the level of job embeddedness and intent to stay of city public health nurses. Specifically, the study will seek to answer the following question. First, what is the demographic profile of city public health nurses according to age, sex, marital status, length of service, and income? Second, what is the level of job embeddedness of city public health nurses according to links, fit, and sacrifice? Third, what is the level of intent to stay of city public health nurses? Fourth, is there a significant relationship between the level of job embeddedness and intent to stay of city public health nurses and profiles according to age, sex, marital status, length of service, and income? So for the significance of the study results can benefit the city public health administrators, public health nurses, nurse educators, nursing students, and future researchers. The city public health administrators can use the data to improve the job satisfaction. Public health nurses can identify ways to improve job embeddedness. Nurse educators can create new strategies for teaching job embeddedness and retention. Nursing students can consider job embeddedness when making career decisions. And lastly, future researchers can build on the study findings. So for the theoretical framework, this study applied by Sister Calista Roy's adaptation model and Terence Mitchell's job embeddedness theory. The model considers person, environment, health adaptation, and nursing. Adapting to the organization's environment can enhance comfort and improve retention of public health nurses. The job embeddedness theory consists of three dimensions: links, fit, and sacrifice. Links involve relationships and support from colleagues. Fit refers to the alignment between individual inspirations, skills, and job requirements, and sacrifice considers the impact on an employee's livelihood if they were to leave the organization. For the conceptual framework, the independent variables contained in this study were the demographic profiles of the city public health nurses, which include age, sex, income, marital status, socioeconomic status, and length of service to the organization. These profiles were linked to the dimensions of job embeddedness as well as intent to stay. Sister Calista Roy's adaptation and job embeddedness theory supported the framework as the different demographic variables each had their own role in completing what was considered to the job embeddedness.
For our hypothesis statement, there is no significant relationship between the level of job embeddedness and intent to stay of city public health nurses and profiles in terms of age, sex, marital status, length of service, and income. For our research design, the study used a correlational research design through the survey method to collect quantitative data. The objective was to determine the profile of public health nurses in a specific city in terms of demographic information and to assess their level of job embeddedness and intent to stay. The researchers evaluated the data collected to examine if there was a significant relationship between job embeddedness and demographic profiles. For our participants, the study targeted public health nurses for a specific city in Negros Occidental and used convenient sampling to select participants. To increase the number of participants, the researchers also utilized snowball sampling, a non-probability sampling method commonly used when the target group is difficult to reach or when there is no population list available. For our instrument, the researchers used a standardized survey to collect data consisting of personal profile information and closed-ended questions about intent to stay and job embeddedness. The survey was tested for validity and reliability. Obtaining high Cronbach's alpha scores, job embeddedness was measured through three indicators: fit, links, and sacrifice. An exploratory factor analysis was conducted on the survey items to assess correlation. And for our data gathering procedure, first, a letter of approval was submitted to the medical officer of City Health Office before conducting the survey. Second, invitations to partake in the survey and informed consent forms were distributed to the participants. Third, questionnaires were handed out during the bi-weekly meeting of Bacolod City Health Office. And lastly, data gathered from the questionnaires were then reflected in an Excel file managed by the researchers.
Moving forward to the results in discussion, presenting table number 3, which showed the demographic profile of respondents, majority of which were females and had ages ranging from 30 to 35 years old. 66.7% of the respondents were married and had been working as a city public health nurses for more than 20 years. 30% of the respondents had a monthly income of 45,000 to 50,000. Table 4 indicates that the respondents showed a high level of job embeddedness in terms of links, fit, and sacrifice, with means of 6.1733 and 5.9889 and 5.7867 respectively, and a standard deviations of 0.60511, 0.76054, and 0.58639 over. Overall, the respondents had a mean of 5.8791 and a standard deviation of 0.58639. These findings suggest that employees feel attached to their organizations, colleagues, and work tasks, which can positively impact their job satisfaction, organizational commitment, and intention to stay. For the Table 5, this provides information on the level of intent to stay among specific group of individuals. Based on the verbal interpretation, the mean level of intent to stay is considered high, with a mean of 6.4333 and a standard deviation of 0.49635. On to the Table 6, this shows the relationship between job embeddedness and profile variables. The results indicates that sex, marital status, length of service, and monthly income are not indicators in the levels of job embeddedness to the participants. Moving on, the Table 7 shows the relationship between the intent to stay and the profile variables. These results indicates that age, sex, marital status, and the length of service and monthly income are not indicators in the intent to stay of the participants.
Moving on to the conclusion, the study found that the public health nurses in the city have a strong commitment to their job and are likely to stay in their current positions. This is because they feel connected and integrated with their work environment, colleagues, and the community, as indicated by their high level of job embeddedness in terms of fit, links, and sacrifice. The study found no connection between the demographic profiles of public health nurses and their job embeddedness or intent to stay. This implies that age, gender, and experience do not affect job satisfaction and retention. Therefore, healthcare organizations should prioritize promoting job embeddedness among all nurses to reduce turnover rates. The study has important implications for healthcare organizations and policymakers. Improving job embeddedness among public health nurses can increase job satisfaction, retention, and reduce turnover rates. Healthcare organizations should consider these findings and develop effective methods to improve the work environment and encourage retention. Moving on to the recommendation, based on the results of the study on job embeddedness and intent to stay of city public health nurses, the researchers provide the following recommendations for various stakeholders. Public health administrators in cities can encourage job embeddedness among nurses by promoting a healthy work environment, providing professional growth opportunities, and recognizing their hard work. Public health nurses can maintain job satisfaction and intent to stay by developing strong relationships with colleagues and the community, aligning personal values and goals with responsibilities, and focusing on the aspects of links, fit, and sacrifice into job embeddedness. Nurse educators should incorporate these findings into teaching practices and curriculum creation to prepare future nurses for success and contribute to a stable nursing workforce. Nursing students should understand the significance of job embeddedness and develop skills and attitudes to build strong relationships, align values and goals with their responsibilities, and be willing to make sacrifices to maintain job satisfaction. Future researchers can explore additional variables such as leadership styles, corporate culture, and job demands to design effective measures to increase job satisfaction and retention among public health nurses. Now, for our utilization, healthcare organizations should prioritize job embeddedness to retain and create an environment that aligns with their values and goals. Nurse educators should emphasize job embeddedness in nursing education to prepare students for successful careers. Healthcare organizations should focus on promoting a positive work environment by fostering relationships with colleagues and the community, offering recognition and growth opportunities to improve satisfaction and retention. Additionally, developing strong relationships among nurses through team building activities, social events, and community involvement can enhance patient outcomes and job satisfaction.